Good evening to everybody. I would like to welcome you and thank you for joining this webinar. Um, I'm very happy that we are here and we have today to discuss um, about the fertility treatments that our clinic provides. My name is Konstantinos, a typical Greek name, and I'm IVF coordinator at EmBIO Medical Center of Athens, working with Dr. Paraskos, which is the clinical director and, of course, the owner of the clinic. Okay, it is an honor for me also being here and presenting all the treatments that we have. We know totally that pursuing a fertility treatment, it is exciting, can be exciting and also emotional. And so my role in this part, first of all, is make every step of this journey, that can be short or long, but every step of this journey smooth, clear, and supportive. This is very important, supportive. From the first contact, the first call, the first message on WhatsApp, the first email, we receive everything until and follow up even after the treatment. We follow up usually the couples also in the first weeks of the pregnancy. So we are supportive in the whole process. Okay. Now, at EmBIO, we have 30 years of medical excellence, thousands of babies born here. We are very happy of that. All couples send us photos with the babies, etc. We're very happy that their trust from the for the clinic, for the team, became then beautiful. We have the desired goal achieved, so we have babies then born, etc. So we're very happy about that, and also give us a motivation to work harder and harder on that. What we have to make the couple feel that we totally care of that, of the whole process. Is not only EmBIO Medical Center is not a factory clinic. So we consider each couple as unique, and we start discussing with them their needs, their request, everything, every step. So they need to be heard, to be listened, of course, and to have immediate replies, answers, what happened in the past, how we can help them to make the step forward. So this is the fully care is what we first of all we do. Okay, we don't promise pregnancies as many clinics can do anything, but we promise that we work hard in order to have the positive result that everybody desires. Okay, so again, I would like to thank you on behalf of Dr. Paraskos and the entire medical team of EmBIO being here, and this journey, which is a beautiful journey, full of hope and trust and new beginnings. So we can start a presentation and we will discuss further about that. So when we receive an email, various requests, inquiries from the couples, we first of all understand what is happening. One of the, let's say, problem that the couples finds or faces is that they have lack of information around the many clinics in this world. The costs are not clear, hidden costs. We have total transparency. We know exactly what the costs are without we forgot to tell you this price and maybe after this cost. We have total transparency and we know exactly what we need and how much the couple needs to spend for the whole process. Many couples around some parts of this world have limited local options, few clinics, or not specialized in some countries in advanced fertility treatments, or they have to wait months. We have couples from the other overseas that needs to wait months before starting even a treatment. So we have no waiting list. Immediately the couple needs to start the treatment or the preliminary part or whatever it needs without waiting months ahead. And we don't have high prices as many clinics in Europe or in US, probably the prices are very high and not for all couples easy to pay for that. And of course, the support, as I said before, the supportive part is one of the most important, because we understand that this emotional journey, the couple needs someone to be with them, not alone. Okay. Just few words about the Greece. Greece became a leader in the fertility. So there are many also clinics, but in the fertility treatments is a leader. So we have nice weather. It's easy to access. So we have all the privileges that a couple needs to spend in Athens also with us, and feeling nice, feeling home. This is our also goal. Regarding the treatments, EmBIO Medical Center of Athens, we provide treatments IVF using own proper gametes, oocytes and sperm. We have the social freezing for ladies that would like to have, let's say, have the pregnancy in a second time, maybe in the future, or if they are single, they don't have a partner right now, they can preserve their fertility for the future. The IUI, especially for very young couples, would like to try the most, let's say, a simpler treatment that we can provide. The donor egg and embryo donation, when we have to face with that, with low ovarian reserve or advanced age of the lady. And for the donor sperm program, for single ladies that would like to have a baby, but they don't have a partner, so use a donor sperm, or couples that the male partner has high fertility issues, so needs to use a donor. So I think that many couples seeking fertility treatments have read about what is IVF, what is egg donor, what is embryo donation program. I have prepared a few words here. The IVF is a treatment that probably stimulate the ovaries of the lady, preparing according to her ovarian reserve and ovarian capacity the eggs in order to be retrieved by the doctor, with the embryologist also fertilize with a partner or husband sperm, the lab culture for a few days, depending the days that should be cultured, and then embryo transfer. So this is the IVF mostly is the standard treatment that the couple has unexplained infertility, has not so high ovarian reserve probably, and needs to check also the embryo quality to see. So specifically with unexplained infertility, when they try to get pregnant for 5, 6, 8 months max and nothing happening. So we have to see technically what is happening, how they can help them. Okay. We have the egg freezing, as I said before, social freezing for ladies that would like to preserve the fertility and have a baby in advanced age later, using the eggs frozen years before, so giving them more chance for a positive results. We have the IUI, as it is a very, we can have a very natural or very light stimulation just the while in order to make the insemination with a partner sperm, which are a quick procedure, a simple procedure done in our clinic. Usually couples in very young age, they prefer to start with that. Is the most simple treatment that they can do. And of course has the lowest cost according to the other treatments, if they would like to try first of all. We have here, hold on, okay. We have the egg donor treatment. The egg donor treatment in our clinic is one of the most important, also in Greece. We have anonymous female donors that have, let's say, extensively checked for genetic diseases, mental diseases, many examinations, serology tests, so are anonymous. The Greek law says 1835, we have an age limit that we use. are very young and have proven fertility status. So the ladies will use these eggs with a partner or husband sperm in order to prepare embryos for ladies that have advanced age, that have very low ovarian reserve, or repeated negative results after trying of getting pregnant or IVFs in the past. So the egg donor gives a solution because it gives higher success rate for these age groups. Okay, our clinic advantage to have high success rates on this egg donor program that can achieve even 80%. This is because the medical team, the donor selection, the process is being designed so well, and also we try all to prepare the lady receiving the embryos as the optimal preparation and optimization, so the embryos usually get implanted and we have pregnancies. We have the embryo donation. Again, same process like the egg donor. Now we have also a donor sperm for ladies that are single, or for couples that have also male infertility issues. So we need to use also donor sperm. Again, the donor sperm can be from our clinic, or the couple or the single lady can also purchase a donor sample from any certified European sperm bank, send the sample in Athens, and use it when the egg donor is ready for the retrieval. Same process as the egg donor, optimization of the lady's uterus and endometrium lining, and waiting until the transfer happens. Of course, we follow up ladies or couples, not only until the pregnancy test that should be 10 to 12 days after the embryo transfer, also the 12 week, the first trimester of the pregnancy. As I said before, the donor sperm program, we have anonymous donor sperms in our clinic, or if the couple prefers to buy by their own, they can have this option by choosing from certified European banks, sperm banks. We collaborate with very important ones if they would like to see by their own, purchasing a sample, send it to Athens, to our clinic, and waiting again until the treatment for the egg retrieval of the donor or ladies egg retrieval happen in order to proceed with fertilization and culture and transfer later. But we support also this part for the donor sperm, help the couple or the lady to choose what is best for the treatment. Now, at EmBIO Medical Center, this is our main points and most important ones. We have personalized treatments. Every treatment is not same as for another lady. Every couple, every lady needs to consider as unique. So we design the treatment based on her fertility status, based on her needs, based on her medical history. We have the dedicated support. She can call us, talk with her, with the couple, anytime that they need. We don't care if it is during the weekend or working hours. We try to support them every day, any time that the couple, the lady needs. We have the high success rate. We have this clinic has optimal results and high success rates. We have AI technology. We have our embryologists, which are specialized, are high qualified, our clinical director, so experienced. So all of this together having success rates high. For the donor selection, yes, we have a strict donor selection. We have this privilege to choose only the best of them. We collaborate, as I said before, with various important certified sperm banks that the couple or ladies need to set by their own. We have cutting-edge technology, as I said before. This clinic uses the last technologies, is continuously evolving and investing on new technologies continuously, never stop. So we are always cutting edge in anything that new that happened and we need to be. We don't have waiting list, which is one of the most important. So the couple, if needs to start, they can start. They don't have to wait. The laboratory, of course, is highly expertized, so is equipped also with the latest all innovation systems. And let's say all these parts together, working with the couple, help us and give major success rates. And of course, what we try always to make the couple feel is like they feel like home. So we know them with their names, we speak to them before an egg retrieval, after, before the transfer. We are always with them. So about the process. At EmBIO Medical Center, we have created a process easygoing for the couple. So not get stressed, not get lost, how, when, who I meet, who I speaking with, when, the timing, everything, the medications, hoteling, booking hotels, what we have to do and when. All we have prepared a process for them, so it can be always easy. And the last question I do usually when the couple or single lady, let's say, undergoing a fertility treatment, is how you felt with this process, how you felt as promised in the beginning, as explained in the beginning. And if all the times we reply the same reply, because they feel that the process was very easy for them, so they could be focused on what they need to do. So we have 3 steps of this process, the 3 phases or steps, we can call them. We have the pre-treatment preparation, we have the first visit and some medical checkup in our clinic. And the third step, the third phase, is exactly the treatment itself as it is, with the embryo transfer and the follow-up after. So we have the first contact, which is the important one. We receive a request by email or by WhatsApp for many channels that we have. So the coordinator gets the request. We book an online consultation, of course, free of charge, in order to get to know us better, understand what is the case, have some questions for them. And then we send them some forms registering in our system and some list of exams that we have during the session, during the consultation, we have asked. So if the couple has done them recently or in the past 8 months, send us all these exams and being evaluated. If the couple has done them maybe a year ago, we send a list which are the most important for every case to be done in their home country. And we can send also orders or medical certificates in order that their local doc or the doctor in their country can prescribe them and send us the results. The couple then, when ready, provide us, if they have already done, or do them immediately these exams, standard fertility ones, send us the exams, our clinical director evaluate them all, and then there is the follow-up by the coordinator when we have the evaluation by the doctor, that he always replies also by email, but it is a second call, second step, that we explain what the doctor evaluated. If they have any questions, reply them all. So this is the most important phase, in order that they have the evaluation, they do understand what happened in the past or when they need to do, and how to go to the second step. We have the second step then, when the couple, the coordinator provides also various information, when to be in Athens, where to stay, etc. The couples arrives in Athens and at the clinic. Of course, the first time we warmly welcome them, because they need to feel that it's not a typical clinic. So they need to feel nice. Give them time also, explore the clinic. The clinical director also welcomed them, and having a checkup, quick checkup, a vaginal scan, discussing with them. They can also have the chance to meet with embryology staff to know exactly the staff that they will take care of them for the treatment. And then they need to sign some legal documents for the treatment in case that be ready when to start. Now, if we have the male partner with them, we can have also a semen analysis, checking again his material. We can have these options, discuss with them if they need anything. And then we have the follow-up, what they have done in Athens. If, for example, the male partner needs to freeze his genetic material in order to be used later, if they cannot be next time in Athens soon or due to work commitments. So we have a follow-up, what we have done in Athens, what we need to do, and then starts the treatment for the next step. Now, of course, we advise them which medication and supplementation and lifestyle way what they have to do. And our doctor prepares, clinical director prepares the treatment exactly when should start according to their plan, personalized plan. So they get the plan, they get the medications. We tend usually to buy them from Greece as cost less than in many parts of this globe. So we always advise them to buy everything here, be ready, and get back to their home in order to start with the treatment when needed. So we also provide everything by email, the protocol, the timing, everything. So they have written, so they know exactly what to do. So they have the meds back at home, they have the protocol written, they have the timing, they know everything to start. Now, the monitoring can be followed in their home country, at least the first part. Give an example, the IVF first part with the ovary stimulation. The couple needs to stay in their home country for until the 9th day, max 10th day of the cycle. So they can stay there, do some vaginal scans, some follicle count there, if they cannot afford to stay for the whole treatment in Athens. So the monitoring, pre-treatment monitoring, or during, they can do that in their home country. And then come in Athens only with, for the treatment itself, an egg retrieval, an embryo transfer, etc. So we can help them on that. Now, the preparation, travel preparation support is when the couple already advises when they have to be in Athens. If we have already, for example, the sperm frozen, or if the male partner should be in advance before the lady for the transfer coming in Athens. So we have all these preparations, of course, not last minute. They know exactly when to book the tickets. Then the couple, of course, receive this communication and anything that they need. And of course, the most important is when the treatment starts, they feel very emotional. It is very emotional for them. So we try also to explain many times. So this is the reason that the consultations, not be just 2 or 3, can be done as many times as they need, because we understand fully that when the couple is focused and they feel nice, they can do the treatment, follow the plan exactly. So we try always to repeat the process, be with them. If they forgot any medication to take, we send messages, reminders, please don't forget to do this today, don't forget that. So in order that the ladies and the couple stays focused on the plan, as our clinical director already prepared for them. And then when they arrived again in Athens, we are ready for the egg retrieval or for the embryo transfer directly if we have to deal with a donor program, for example. Again, we will warmly welcome them, staying there, explain them the process. For example, for IVF, we explain what to do before the retrieval. We have the retrieval, how many oocytes we took, how the lab is working for that. And we constantly be with them until the embryo transfer on that day, when we give them instructions to follow post-transfer for the next 10 to 12 days, buy probably supplies for medication needed, and generally be sure that when they leave the clinic, they have all the plan for after the transfer and just waiting the good news from them. I have prepared here some basic standard fertility exams that we usually request from the couple, from the ladies and male partners. We have requests that have done negative IVF treatments in the past, so we need to investigate more. So we have some advanced exams to understand if many negative results happen because we have to deal with immunological issues or thrombophilia or blood clotting or anything. So what we do usually is request some standard exams, and if we have negative results or many negative results, we try to invite them in Athens to investigate more what happened instead of just keep trying and wasting time and money, of course. So we try to make some extra tests like the karyotype, like the antibodies, NA test, etc. Same also for the male partners happen many times to understand what happened. So some DNA fragmentation test, for example, to understand what happened about the male infertility. And we always invite them to be in Athens discussing live with our also embryologists to help them doing these exams preliminary when they arrive for the first visit, for example, in order to prepare the treatment later and have major success rates and not just starting a treatment only with a standard list. So what we have to do, the most important, is that every single case has to be designed personally. And even if we have ladies with the same ovarian reserve, for example, it's totally different. So every couple needs to be considered unique. And that we constantly try to do. Help every single case, and of course, understand which are the best success chances that the ladies have. So we always give them advice instead of this, do that, for example, if they would like to follow the advice. So the couples then, or the ladies, need to decide having all the information. So they are fully informed and they need to decide what is best for them, first of all, because we respect their decision. So as it is written, embarking on fertility treatment is a very truly special journey. We believe that 100%. So, and we are very happy and proud to share this special journey with the couple, with you, and with support, with compassion, of course, understanding, but the most important is the trust. So this is our main goal. Make you feel trust that somebody here takes care of all this process. If you have any questions, please, of course, ask me. I would like to reply them all. I have a question here. Of course, you have to know that medical questions due to GDPR needs to be replied personally. However, the reply as wrote in here, when we have a lady in the age group between 40, 43, max 44, can of course try to do IVF, trying with her own gametes. Okay, we have achieved also pregnancies for ladies above. It's not impossible to happen, but every case needs to be checked, needs to prepare the plan with a milder IVF, probably with a natural cycle. We have various IVF treatments that we can prepare for this age group in order, yes, to succeed. Maybe the first time we don't know if we'll be positive immediately. We try, of course, depending how the ovaries work. We have also pre-treatments to help with supplementation as well, in order to help this age group have major success rate. So potentially yes. If you have any question, of course, other. Now, in our clinic has, let's say, I'm not using the words patient. I don't like it. Couples. We speak with couples. We deal with couples. We have couples that are from entire globe. We have from Canada to Australia, and because we have some countries, for example, Italy, Germany, France. We have also coordinators if the couple speaks only that language, Italian, German, or French, that they can take care, same as me, the process by providing in native language, in the same language. So they don't need to translate with Google or anything. So they have their own proper language to have communication, which is even better. Now, the whole process usually take. Now, if we have, let's give an example. If we have to deal with a standard IVF, so own eggs and own sperm, the entire process, let's say about 3 weeks. Now we have the ovary stimulation that our programs usually starts on the second day of bleed and last for on the next 12, 13 days max, stimulating the ovaries. So having the egg retrieval 2 days after, few days after again, the embryo transfer. So the whole amount of time is about 3 weeks. The monitoring can be done in their proper country, home country. So they need to be in Athens for minimum 10 days, let's say in total. And we understand that because we are not during the summer, so they can have holidays, etc. Not so easy for them staying away from home for 3 weeks. So we try always to adjust the treatment based on also work commitments. I have another question here regarding now, if we have to deal with male infertility, we have also appointments with our embryologist, with urologist, in order to check the quality and what is the status of the male fertility in order to provide solutions. So we have various solutions about that we can use. For example, with testicular from the testicles, getting sperm directly from the testicles, or aspirate or extract. TESE or TESA are treatments that usually being used in our clinic. But first, we have the first visit in Athens in order to ensure which is the case that we need to then apply the service what they need. So potentially, yes. If you have any question, please. Just before reading the next question, what we try always to do with the various consultations, of course, are free of charge. This is the main reason, in order to reply any questions, any concerns, provide again the payment plan, how they need to pay, when, how the treatment will be, how they feel about starting with the treatment, the support. So this is the main reason that when we receive the request and we start the communication, we constantly are in contact with the couple to ensure that everything runs going well and to have all of course, I read here a question about the list of the services. If you like, you can send an email. I will provide. We have the list of all our services with all the prices exactly, so you can read and exactly see all the services included. Yes, we can have these consultations for couples. Yes, we do have that struggling with IVF. And you have to know and understand that when we have to deal with a couple that would like to have a baby with their own material, own gametes, we don't force them or push them to go for egg donor. We try to help them understand better the chances, but in the end of the day, we support them and respect their own decision. So we do all our best to help them achieve their goal based exactly on their decision. Because in the end of the day, is the couple that needs to take the final decision, and we need to respect that. And of course, we do. I totally understand what I read here, that most of the times, what you can hear more often when we have a negative results of IVF or when we try, we don't, let's say, stress the couple about choosing, because it's not easy for a lady saying, you will do egg donor is better. It's not so easy to accept and to understand, and they would like to try with their own material. So we make investigations. We promise them that we work and do everything needs in order to succeed. But at the end of the day, as I said, we respect their decisions. We don't say no. We advise to make this plan B, so we do only this. No, no, not at all. We try to prepare tailor-made treatments with our own needs in order to have a positive result. We cannot guarantee 100%. In entire planet, nobody can guarantee 100%. But we promise that we work hard on that, and we have had the success rate on that, because we have prepared extensively with investigation of the couple and need to work in each case. And we had. Of course, we are not lying. We don't create false expectations saying tomorrow you get pregnant or anything. No. But the couple see how we work hard with them for that. Ask me questions if you have, please. However, I know that it's very difficult when we have a couple or a single lady trying with own eggs and trying again and again, or have maybe tried many times in the past in various clinics, whatever. And it's not easy. They really want to try with own, and we respect that. Again, I'm saying because I read the questions about that. So we have pre-treatments that worked and try, and depending of the ovarian reserve, depending of the age group, we had success rates. Now, because many couples say, okay, other clinics, they directly advise for egg donor. Of course, in some cases, the egg donor have it's more efficient, major success rate, because with less treatment, you achieve the pregnancy. With own eggs in some specific age group, maybe they need to try more than one time. We don't know that from the beginning, but we try that the first time that happened, be fully prepared. This is what our goal is. Now, regarding the procedure with the implantation. Now, the embryo transfer, our clinic policy is transfer to embryos. According also to the Greek law, based on the age group, when we have to deal with the IVF with own eggs and sperm, up to 42, 43 years old, we can transfer 3 up to 4 embryos. So our clinic policy is to transfer 2 in the beginning, or if there are some cases, medical cases that the doctor advises to transfer single embryo, we transfer just 1, and if viable the others, freeze them. But our clinic policy is initially transfer 2 embryos. That gives major success rate. If we have lady at 43, for example, 44 years old, according to the Greek law, we can transfer up to 4 embryos in this case, in some cases. Of course, the couple and the lady needs to confirm that. Doesn't mean that if the Greek law or if we advise, the lady would accept. So we speak with the lady with embryologist and we go based on their also decision. But our clinic policy is initially transferred to embryos. Of course, if we transfer the two embryos and we have more viable, the couple has the option to freeze them. There is the service, the embryo freezing, and store them in our clinic and use them if a negative result happen for a try again with a frozen embryo transfer cycle or for a sibling. Now, the ovarian PRP, this is a service that we do have in our clinic. At this age group, yes, if we have a low ovarian reserve, we can also start with the PRP treatment in the beginning with the supplementation followed after the PRP. And in the next month or max couple of months, we can start the personalized IVF protocol, give even a better chance. This is one of the pre-treatment that we have. Yes. So yes. Of course, we have ladies at the age group of 44 that have standard ovarian reserve, have ladies that have very low ovarian reserve. Of course, the PRP is a natural treatment that worked with the ladies with ovarian reserve, and we offer this service. We have this service in our clinic, and we discuss about that during the sessions that we have with consultations. Now, if the day 3 or day 5 transfer, in our clinic at EmBIO, we have day 2, day 3, or even day 5. Now, what is most important is not everybody understand what is day 2 stage development of the embryos, day 3 or day 5. Even if they have read over the internet what is this means about the process, our embryologist, together with our clinical director, advises what is the best for them. In our clinic, we have the advantage that we have achieved pregnancies with day 2, day 3. Generally, especially in Europe, they're talking only with day 5 embryo transfer. But in our clinic, we have achieved many pregnancies with day 2, day 3, because the embryo is being developed inside the natural habitat, let's say, which is the womb, it's the uterus, and we have achieved many pregnancies on that. But depends. If we have, for example, a lady that has underwent treatments with negative results on day 3, we can obtain with day 5, or the receptivity and the fertility window is different for every lady. So we don't have the policy do everybody day 2, day 3, or day 5. We need to understand if it is the first time IVF, if happened in the past, which day was the transfer, if we have the miscarriage, in which day, etc. And we need to adjust the treatment. So it's not a standard day 2, day 3, or day 5. It's based on the case, speaking with our embryologist, with the couple, taking the decision and following, of course, their advice. So we have all options available. Of course, just to finish that question is important, depending the quality of the embryos, the number of the embryos, there are many factors which is the best day for the transfer. Of course, we cannot know in advance how many embryos will be and which day will be ideal. It's during the treatment and after the retrieval, speaking with embryologists, we know exactly what to do. And of course, communicated with live with the lady and the couple and taking that decision. The consultation is online, yes, as many times as needed for every lady. So we can have this service for free. And the reason that is we don't want to fill the cup that we do these consultations and have to pay. It is for free exactly in order to reply questions, understand the case, provide information from asking and getting information from the couple, provide information to them. So yes, online. Yes, we do have. Usually, let's say with every single couple or lady, are many, many calls to do. And we adjust the timing for them because, as I said many times during this session, we retain very important that the couple feels okay, everything's set up, clear question, clear mind, focus on the treatment. If you don't reply them all, the problem starts that the couple cannot follow the plan, maybe mistake about the medication, the dosages, everything, and then the success rate cannot be so high. So we need to follow exactly the plan. So we can speak as many times as needed, and we offer that for free and wherever needs. I usually speak even Sundays if needed, so it's not problem at all of that. Make their life easier is more productive also for us. Please, other questions. And I would like also, until I receive another question, when we have, for example, a past negative result during the first visit, after the doctor has evaluated their case, if needed to have any investigation, for example, some blood test or any hysteroscopy examination, checking the uterus inside to see what happened, if any scar tissues is there or anything left over, anything to clean, any polyp, anything that may interact negatively for the future treatment. This is the main reason that the first visit should be, because the preparation, pre-treatment preparation is very important instead of just, okay, this is the case, the case, take the medication, start that day. We try to advise the couple coming in Athens for the first visit, if possible, to make an investigation first. So it's very important. Questions? I have a question here. The treatment for anomiosis. I will share with you some information by email. If you like, we can have an online consultation. Our clinical director provide evaluation, Dr. Parasos, and we can discuss. We have also, yes. Any other question? Anything to ask? Anything? Sometimes the couples say, okay, I have a question, maybe it's silly, maybe it's not. We have to hear all questions, anything, anything that it's in your mind. It's important to know exactly what you think, any questions you have, any concerns. Help us a lot prepare a tailor-made treatment and provide you better service in this way. So ask me anything that have in your mind, anything. If we recommend, yes, do STEAM. Depending the case, this is what I say. We cannot recommend A or B to everybody. We need to understand the case. We need to work on this case, and see if it is recommended. And for sure, our clinical director, if it is recommended, prepare the treatment in this way. Now, our laboratory uses all advanced technique that needed, even for male infertility. But this is the main point of this clinic. The tailor-made treatment cannot be used, for example, as a lady asked before, to esteem for everybody. Cannot. It's depending of the case. Some ladies work. In some cases of the stimulation needs to be done. Some others no. It's something that we need to see the case, especially when we have to deal with a case that done previous treatments with negative results. There is even more, because when we receive requests are not only ladies or couples that it's the first time, the first contact with the fertility treatment. Many times happen that ladies have a medical history, fertility history, so we need to see. But 100% we give them the chance to decide which are the options, which is the protocol, and discussing about, of course, when the doctor and prepare the personalized protocol, we have an important call in order to understand, make the ladies and the couple understand the protocol, not just read an email and this is it. They need to understand, speaking with them, pro and con, for example, and then deciding, okay, we have to move ahead on that. Now, I have a question here. The quality of the egg. For the quality of the egg, if we have a low proton reserve with the PRP, we have supplementation also. For example, DHEA, we have some more supplementation also be helping about that. Of course, it's better to have an online consultation and present all the possible ways of pre-treatment, helping the quality of the egg. We can have this done if I think if you send me an email, your email, I think that I have an email here. I can prepare. We can have an online consultation if you like, or anybody if likes, in order to discuss case per case. Perfect. Any other question? Anything to need to ask for the treatments that we spoke before? However, due to GDPR, I cannot share names and surnames. But the most important part of this journey is when we receive, in the end, a positive result, even if it was with own eggs or donor egg or embryo donation. Most of the times, the ladies are like shocked; they couldn't believe, and we are here. Trust us. Let's go. We can do that. And the most important part for me, for my role, is when I receive this part, this message, because means a lot. Means that this hard work in the end starts with a new beginning, with something new, starting from the positive test. And for us, it's very emotional as well, and encourage to and motivate, work harder every time to help the couples. As I said, it's not a factory clinic, so we deal with different cultures, different from all over the world, but focusing each couple separately, exclusively. So understand. And when we see the positive result for us, it's a very nice moment. Now, if we have a couple that, for example, in some countries they don't speak, for example, English, which is the international language, we can have a translator if they like, or if they can have their own translator. Yes, we can do that because we retain important that the communication must be well done, not only written and with Google Translator, but also live. Then we can have this service. But we always, most important is that the coordinator tries using simple words, not so technical words that the couple or the lady is being confused or needs to search what does this word mean, what does this happen or anything. We try to use very simple words to make them understand. The technicians, the laboratory has their own, but the coordinator needs to communicate with the couple with very simple words without so technical ones to make them feel, okay, this is the way, this is what we need to do, we need what we gain, etc. But if needed, we can have the service of the translator. Now, last important thing is also, as I said before, the medication for each treatment, supplementation, medication for everything. We collaborate with very professional pharmacists that we can deliver the meds in their own countries. If in some countries it's not allowed to import medication due to restrictions, we provide them the order, the prescription to find them, or during the first visit, we advise to buy them at the beginning. So not only in terms of the pricing, but we collaborate with very professional pharmacies that have always supplies. So they always stock medication. So it's impossible not having the whole amount of the medication or need to wait for a new order or wasting time. So it's also this part important. And in some countries that is allowed to, let's say, deliver them, we use with, for example, DHL courier that usually in max 2 working days arriving in their home country. For example, UK, in max 2 working days, they have at home. So they can have the plan, have the meds, have everything ready to start. Because in some countries it's difficult, local doctor, prescription, have to go to the chemist, maybe they don't have these meds, go to another chemist. It's very frustrating and confusing. So we prefer or during the first visit or send the meds directly at home so they have everything ready. Do we have any other questions or anything to ask? Of course, you can see my email address. If anybody would like to have a online consultation or any questions may have, can email directly. I provide my WhatsApp number, which is always available, always active, so can ask me or call me anytime. We have a web calendar that they can book a consultation based on their own time zone and days and timing and availability. And if of anything they need maybe to ask, catch up messages on WhatsApp, we are here. And finally, is that this service about the follow-up is, as I said in the beginning, with this lack of communication and support, is one important step of this journey. Because we understand that this lack of communication about the treatment or the support does not help at all the couple. So the first time they, as in my experience, they need please be with us all the time. This is the most important I hear every time that I speak initially with a couple. They need to feel that they have somebody that take care of them. If you don't have any other questions, we come to the end of this today's webinar. I would like to thank you for spending this time with this session with us here, for your attention, your questions. If you have any questions, of course, send an email. We reply them all. It was a pleasure for me being here, sharing what EmBIO Medical Center in Athens provides in various fertility treatments. And we have for all international, not patients, couples, as I said. I hope and wish that this session, this webinar was informative, that help you feel more informed, more confident, and of course, that you feel that somebody will support you in case that would like to have a consultation and proceed with our clinic for the next steps, let's say. Now, every story begins with a hope. So when we have a successful outcomes, make feel us that the couple trust it. So the trust is number one. And we try to guide you in every stage, of course, with care, with compassion, and with trust. So I would like to thank you, promise you that you are not alone. Somebody will take care of you in every step of this journey, from our clinical director, Dr. Paraschos, to the IVF coordinators, to the embryology staff. So warmly thank you for joining this webinar today. And of course, if you would like forward to have any questions, anything to book an online consultation, feel free to reach by email, and we will have this consultation wherever you feel ready. So I would like to again thank you, and hope to see you in Athens if you can be in Athens to start with the treatment. However, until we met in person, I would like to send you my warmest regards from Athens. Have a lovely evening to everybody. If you don't have any question, the questions replied. So